Good afternoon, Mr. Parker Agunanan. How are you?
Good afternoon, Dave. I'm fine, thank you. What about you?
Excellent. I'm very, very well. It's a pleasure to have you here. I know that you're very, very busy, and we appreciate your time. And we also appreciate everything you've been doing from January till now, getting us through this very critical period of COVID-19. I want to just spend a little time with you now to chat, maybe for about 10 minutes, about what's happening in Saint Lucia now. How can people move and function? Who can go back to work now? And what's going to happen for the next maybe 6 months in terms of our precautionary measures for COVID-19 and beyond? So thank you again for your time. We know you're very busy. And firstly, what's happening now in terms of COVID-19 in St. Lucia?
In terms of COVID-19, currently, St. Lucia has no active cases of COVID-19. We've had 18 cases, and they've all recovered. We have had no deaths in St. Lucia. We continue to do our contact tracing and to do our monitoring to determine whether there are any positive cases out there. Testing is actively being done as well. But as we speak today, there are currently no active cases of COVID-19 in St. Lucia.
Okay. And
as a result,
Go ahead.
The government of St. Lucia has taken a decision to employ a phase opening of the country. And in this phase
opening.
Yeah, so there are going to be
what's going to happen?
A number of phases in terms of opening. So there's going to be a gradual opening of St. Lucia.
Right.
And so as of today, the 18th of May, the decision has been taken for a number of business places to begin to offer services. Before I itemize these business places, I want to say that for a business place to operate, it is predicated on them meeting the protocols that is established by the Ministry of Health. These are very clear protocols, and on the weekend they went out on the government website, on the Ministry of Health website, on social media, some of the protocols that would guide the operations. And so we encourage all business owners in the various categories to review these protocols and to develop their own personal plan, because as we know, there are intricacies and differences among each business place and each type of business that is in operation on the island. Therefore, the plan would have to be tailored to meet your needs. And therefore, we encourage business places to look at these protocols, to go through the key areas and prepare a plan to be submitted to the competent authority for review before they can actually begin opening of the business. So I would just want to reiterate that whereas today you can open, it does not mean that automatically you will open every single business. You need to have certain basic requirements in place to allow you to operate. What are some of the services that are expected to come on stream as of today? Well, they would include the health services that would include the private medical offices and doctors and laboratories and so forth. The hospital services, the pharmacy services, medical shops, food and beverage supply, as we know that restaurants were only permitted to do takeaway. That can change, but again, you need to have the arrangements in place to ensure that there is the physical distancing in the sitting arrangement and other provisions for hygiene, especially hand hygiene practices. Farming and fishing, the water supply, electricity supply,
Mhm.
Sorry, the water
Telecom.
services, the electricity services, telecommunication services,
Mhm.
sanitation, gas stations have been functioning, all gas stations, auto vehicle and garages,
Mhm.
hardware stores, financial services, judiciary,
Right.
broadcasting media, construction businesses and construction sites, home stores, general malls, beauty services. So, in the beauty services sector, we're looking at the barber shops, the
Mhm.
hairdressing salons, and the
Right.
manicure and the pedicures. Um,
Other government offices, call
yes,
centers,
government
and
offices, the
religious
call
institutions.
centers, places of worship.
Right.
Again,
And
these
when you
protocols have to
say
be met. Gyms
right,
and such facilities, some sporting facilities, not all. And I want to qualify that because these in the first phase would be sporting facilities that do not encounter physical
contact.
contact
Right.
between the participants. So
Mhm. Mhm.
sports like football and basketball and so forth will not be permitted in this phase of the opening. But
Right.
tennis, where you have no physical contact,
Right.
these sports would be permitted. And
Mhm.
then the beaches would be open, but to limited numbers at this point in time. And
Right.
therefore, there should be no beach parties or beach bash activities. So small family members with small groups are permitted to go
Mhm.
back on the beach. So
Now, a lot of
these
people
are
want to go
some of
back to.
the
Mhm.
new areas and business places that are permitted to commence operation as of today.
Okay, so I know a lot of people want to go back to church, want to go sit in are the churches also required to submit a document to the competent authority of how they're going to move forward?
Sure.
Okay,
The
excellent.
responsible ministry for churches, that is the Ministry of Equity, Social Transformation,
Mhm.
Local Government and Empowerment, have written to the church leaders and have submitted to them the protocols, and as part of that has requested that the church leaders submit to that ministry a
Mhm.
plan indicating how they intend to implement the protocols in terms of the
Okay,
seating arrangements, in terms of the size of the buildings, the capacity of these buildings. And I just want to say that the provision where only 10 persons could have attended a funeral service or wedding, that has now been suspended. And
okay,
therefore, funerals and weddings would be accommodated based on the square footage of the building to make
okay.
adequate provisions for the physical distance measures.
Mhm.
Therefore, it is expected that every church administrator would submit to the relevant ministry a copy of their plan to indicate the square footage of the building and how they intend to use that space to arrange for the seating of the members and visitors to that church.
Thank you so much. Who can go back to work now?
Sorry, I'm not hearing you very clear.
Who can go back to work at this time now that everything is
Yes,
open?
so going back to work, like I've said, offices are opened, both
Mhm.
public and private offices. Today,
Mhm.
the government offices began resumption of activities, and so by this week, we would see a rollout plan for all government offices to be opened and to provide services, as well
Right.
as private offices, like we've said,
Mhm.
can open. And I've given an outline of all the different sectors and business places that are allowed to operate at this point in time. So persons
So,
who are employed in these services and who still have an employment contract would be required to go back to work.
all right, and that would be people who are older, because a lot of places are managed by people who would have fallen in the vulnerable or elderly age limit. These people can now go back to work and resume their management responsibilities at these various places that they work.
Yes, generally people can go back to work. We are still concerned about people with underlying conditions and immunocompromised situations.
Right.
We would still advocate for these persons to work from home if possible.
Right.
However, there are the preconditions for returning to work, and that is to wear the face mask, which is a must now. It is also important for people to pay attention to personal hygiene, hand washing, sneeze etiquette, as well as the use of hand sanitizers. We also encourage all persons to observe the physical distance measures in the workplace as well.
Right.
And that is to try to stay 6 feet away. And we are encouraging people as much as possible not to use common items. So we're discouraging people from sharing cell phones and tablets and meals and that kind of thing at this point in time. It's not you should be,
Right.
we're not encouraging people to be selfish, but at the same time to take the proactive measure to protect themselves and to protect their colleagues. And therefore, these are the basic guidelines and principles that must be observed even now in terms of returning to work.
What would St. Lucia look like in the next few months in terms of COVID-19? And will we continue to wear the face mask, continue to practice the physical distancing, continue to take all of these protocols in a very rigid manner for the next foreseeable future 6 months, perhaps?
It's difficult to determine where we're going to be in the next 6 months, as we know that the situation with COVID-19 is unfolding. We're seeing what's happening to other countries around us and further afield, and that too would have an impact as to how St. Lucia would respond. Having no active cases presently does not mean that St. Lucia is free and clear from that pandemic. It's very possible that we may have other cases that would come up.
Yes.
Once the borders are open, it creates another challenge, and therefore we are not living in a world all by ourselves. Therefore, it would depend strongly on how well we are able to manage new cases that may arise to limit spread, and that would determine how we go forward. Further, it also would be dependent on whether a vaccine is found and adequate treatment. As we know, treatment now is a major problem, whether there would be adequate modalities of treatment available for COVID-19. These all would determine how we go forward in terms of life returning to normal. I know we are living an abnormal life generally. So these are the things we need to look at in terms of how we move forward for the country as a whole. What other business places are going to be opening in the future, and what protocols would have to follow even as citizens in terms of protecting ourselves, whether we should still wear face masks or not. So these are the things we need to look at in terms of going forward.
Mr. Ragunanan, thank you so much. Thank you for taking some time out of your very busy schedule. I know you're in meetings upon meetings. We appreciate the little discussion. We appreciate the information and the clear understanding. And thank you so much for joining us. Do have a wonderful day or an amazing week, and continue to do what you're doing. We appreciate you when we thank you.
Thank you so much for having me, and have a blessed day as well.
Excellent.